The ALTA-1L trial was a randomized phase 3 trial evaluating the efficacy of Brigatinib, a next-generation ALK inhibitor, in the frontline setting for ALK-positive patients. It's a randomized phase 3 trial, multi-center global trial, in which patients with advanced non-small cell lung cancer who could have been exposed previously to chemotherapy were randomized either to receive Brigatinib or crizotinib. Patients with baseline CNS metastases that were active could have been enrolled, and the primary endpoint of the trial was progression-free survival by blinded independent central radiology review. So ALK inhibitors are generally very effective against patients with CNS metastases if they have ALK-positive lung cancer. In fact, we know that CNS metastases are an important problem for patients with ALK-positive lung cancer. Across many of the trials that have looked at ALK-positive lung cancer, around 30% or so of patients had CNS metastases at baseline. And indeed, when we look at ALTA-1L, this is exactly what we see. 30% of patients had CNS metastases. Previously, we've been using crizotinib, which is a highly effective ALK inhibitor, but it does have some limited efficacy within the CNS, and often the CNS is one of the first sites of progression in patients on crizotinib, and therefore, as the trials have matured, we've identified that the next generation ALK inhibitors are superior to crizotinib and also have superior intracranial control. In the ALTA-1L trial, we looked at progression-free survival by blinded independent central review as the primary endpoint. Secondary endpoints included progression-free survival by investigator review, safety, response, intracranial efficacy, as well as quality of life. In the ALTA-1L trial, we've recently had an update of efficacy from this trial. This was presented at the ESMO Asia meeting last year, which is the second interim analysis. Now, this is a much more mature data set, and this demonstrates the marked superiority of Brigatinib over crizotinib with a hazard ratio for progression-free survival by blinded independent central review of 0.49. Importantly, we continue to show that there was improved response rates for Brigatinib over crizotinib, and of course, because of the crossover design of the trial, there was no overall survival advantage, and indeed overall survival is immature really to make any meaningful conclusions at this stage. The second interim analysis of ALTA-1L does demonstrate a superiority for Brigatinib over crizotinib, and to my mind it does translate to it becoming a first-line treatment option for patients with untreated ALK-positive metastatic non-small cell lung cancer. We know that patients with CNS metastases have inferior outcomes in general with ALK-positive disease, and so therefore having intracranial control is really quite important. When we look at the CNS outcomes of the ALTA-1L trial, we see a highly effective outcome with Brigatinib, insofar as patients with CNS involved at the time of enrollment with CNS positive disease, the progression-free survival by blinded independent review committee hazard ratio was 0.25 in favor of Brigatinib over crizotinib, and indeed it remained very effective also in patients without CNS metastases with a Burke PFS hazard ratio of 0.65. At the ESMO 2020 meeting, we presented further details on the CNS activity of Brigatinib. We know that around 30% of patients had CNS metastases at baseline. Around 15% of these had prior radiotherapy. Overall, brigatinib was highly effective in patients with CNS metastases with a progression-free survival hazard ratio of 0.25. And in those patients that had had prior radiotherapy, it was extremely effective with an intracranial progression-free survival hazard ratio of 0.15. In patients with CNS metastases, brigatinib was highly effective with a response rate of 80%, which compared very favorably to crizotinib with a response rate of 30%. And when we look at patterns of progression in the brain, we see that patients on crizotinib tended to relapse first within the brain, which is less frequently seen with brigatinib. And indeed, when we look at patterns of relapse within the brain, we see new lesions really as the major issue in both groups rather than loss of control of established lesions.